The isolation of the operative field is an essential procedure for the dental practice performance. It has been used since 1864, when S.C. Barnum introduced this technique in dentistry. Isolation can be used both in children and adult patients. It allows to isolate the operative field in different dental procedures, like operative dentistry, tooth whitening, and root canal procedures. The rubber dam has a lot of benefits. Protects and separates soft tissues, controls oral fluids, protects the patient and oral cavity against the accidental fall of tools and restoration fragments. However, the most important benefit of the rubber dam is that it allows to achieve a complete isolation and protects the operative field against contamination. To perform the isolation, it is required to have all the necessary tools. Rubber dam, which exists in different colors, different thicknesses, and different materials, latex and silicone, which is anti-allergic. Here we have the wedgets, dental dam stabilizing cords, which work as clamps. These wedgets are rubber laces, and there are 3 types of different thicknesses. The dental floss will help us to place the dam at teeth contact points. We can also use a gingival protector, which can help us in difficult cases. For example, when we are not able to ensure a proper isolation. The rubber dam templates guide us at punching them, and there are different manufacturers. They are made of plastic, cardboard, or wood tampons. Here we can see the top and the bottom. There are different types of clamps. The clamp number 1, the clamp number 5, the clamp 00, the clamp number 7, the clamp 212, and the W8A. There is a huge variety of clamps or staples, and logically also many companies that offer them. We mainly use the ones that we have just named. We have a metallic young arch and a plastic Ostby arch. There is also a swing arch, the Sauber arch, which has the same function as the rest, but is made of plastic, and this allows to make X-rays during the treatment without removing the entire arch. We need a punch, in this case the Ainsworth punch, which its main characteristic is that it has a punch and a wheel. And this wheel has holes of different diameters that help at making perforations of different size, depending on the tooth that we are treating. There are also the ivory and ash punches. All 3 have the same function, to pierce the rubber dam. Here we have the clamp holders. There are several types of them. This one is an ivory, which is the one that we are going to use. The Brewer and the Martin ones. These clamp holders transport the clamps to the mouth. There are various types, as we have mentioned before, and the main difference between them is that they have the attachment points at different levels. Once the identification of the instruments is done, we need to consider what kind of isolation we will perform. We can isolate just one tooth, doing a unit isolation, a hemi-arch isolation, or a complete isolation of the lower or upper arch. The isolation depends on the treatment that we are doing. It is not the same to perform anesthetic rehabilitation, an individual restorative treatment, a canal root therapy, or a whitening. It is important that, prior to the isolation of the operative field, we verify the status of the whole mouth. We use dental floss to check the interdental points. It is important to verify that we only have retention at contact points between teeth, because unwanted retention can produce a tear on the rubber dam. We are going to check the contact points with the dental floss in order not to have any interference when placing our rubber dam. We can use a rubber cup and prophylaxis paste, usually used at the practice to clean the area.
que es la pasta profiláctica que normalmente usamos nosotros en clínica, y procedemos a la limpieza de la zona.
Once the dental prophylaxis is done
La zona bastante higiénica,
and the contact points have been checked,
pensamos nosotros que son los correctos.
we are going to select the clamps.
Primeramente, le comentamos al
In order
paciente
to
que
select the
notará
most
mucha
appropriate
presión y
clamp,
fuerza. Una
we
vez
should check the
colocamos
stability
el clamp,
and if it fits on the
comprobamos
tooth.
la estabilidad de en el diente.
If
Si la
everything is
estabilidad
correct,
correcta,
we
pues
can select the clamp
procedemos a la
and use
elección
it to
definitiva
begin
del
the
clamp.
procedure.
Una vez hemos realizado la elección definitiva del clamp, procedemos
We start
a
doing the
la
perforations
perforación
on the rubber
del dique de
dam.
goma.
Once we have all the perforations, we begin to place the rubber dam. The isolation of anterior teeth can go from canine to canine using attachment points at first premolars or at the same canines as clamps, depending on what we are going to do. We can do this directly or indirectly. In this case, we are going to make it by the indirect way. Firstly, we set a distal point that is supportive to stabilize the rubber dam. And then we control the contact points to put the rubber dam down and finally stabilize it with the final point of attachment. The dental floss can be used either at this point of the process or at the end. But the best is to put the rubber dam down slowly and gradually so it allows the best adaptation of the dam. Once we have this, we can proceed to the second attachment point. Once we have set both points and our isolation is completely stable, we begin to put the young arch. In this particular case, a metallic one. It is desirable to use a plastic arch because it allows to make X-rays without removing it, and it does not appear on the radiograph. Now we can place the clamp and verify the stability to check if this clamp was the right one for our isolation. In this case, we are going to use an indirect technique, step by step. We put the clamp first, next the rubber dam, and at the last step, we place the arch. Once placed, we set both corners of the rubber dam. In this case, the most distal point. Later, we can thread the rubber dam through the ring. We need to stabilize the other corner and place the other clamp previously chosen for this sector. Once we have set the two subjection points of the rubber dam, we could recheck how the rubber dam fits at contact points to avoid contamination and disorders on our vision of the operative field. The final step is to place the arch to give stability to the isolation. Now we have the best vision of the operative field to begin our job. Now we are going to make an isolation unit. Once the best clamp is chosen, we check its stability inside the oral cavity and if it is the right one for our isolation. We place the rubber dam at the workplace point. Usually, the unit isolation, as its name suggests, is a single piercing on the rubber dam. However, we tend to expand it a little more to increase and improve our vision of the operative area and to avoid interferences during the placement. In this particular case, we work on a lower incisor, where we place the rubber dam. Now we can repeat the contact points, checking with the dental floss to put the rubber down to the gingival area, and once done, we can place the clamp. This is the isolation that we usually make for whitening treatments, in which we put 2 clamps at both sides of the dental arch to improve the stability of the isolation and increase the amplitude of the operative field. Once we have fixed the rubber dam at contact points, we can tie the dental floss to each tooth individually. Secondly, we cut the floss
Procedemos a poner otro hilo, bajar hasta el punto de contacto y luego proceder a estirar hasta que el dique de goma llegue a nivel de la encía.
and we can repeat the same action with the rest of the teeth.
Se sucederá en los demás dientes.
We would like to show different ways to bring the rubber dam to the mouth. One option is the indirect technique. Firstly, webbering the clamp to the tooth, and once the clamp is placed, we can proceed to take the rubber dam. In this case, we have a clamp that does not have wings, so we usually pass the rubber dam through the ring. Then we can put the arch at the final step. The second way is the indirect too, in which we carry the clamp and the rubber dam all together, and once we have placed them, we can put the arch.
En este caso estamos trabajando con un clamp que tiene aletas. Y una vez hemos procedido a colocar el arco, vamos a bajar las aletas, la goma que se encuentra a nivel de las aletas para que el aislamiento sea correcto.
The third is the direct way, when we bring all the tools together, arch, clamp and rubber, to the place that we are going to treat. After the placement, we also need to put the rubber dam underneath the clamp wings.